The quality of life that you add to your patient, that patient is going to be a patient for life. You've changed their life. Now, I love doing crowns and Invisalign and traditional braces and placing implants. Sure, I improve their oral health and get them out of discomfort most of the time, but nothing is more rewarding self-gratification than helping someone sleep better.
Welcome back to the Dental Economist Show with me, Mike Huffaker. Today, we're thrilled to have Dr. Rad, a distinguished dentist and entrepreneur, joining us. Dr. Rad has been a key figure in the dental industry since 2002, owning and operating leading dental practices like 805 Dentistry and Oxnard Gentle Dentistry. Beyond his clinical expertise, he's also the force behind Rad's Seminar and Coaching, where he offers innovative seminars and coaching programs that focus on areas like sleep apnea, medical billing for dentists, and marketing strategies. Welcome to the show, Dr. Rad. How are you doing today?
Thanks, Mike. Thanks for having me. I'm excited to share to your audience about how to get better sleep. That's kind of been my passion over the last 20 plus years. So ready to dive in and have everyone get a little bit more rest nowadays, because sleep is a very valuable asset in our lives.
It is so important. And so this is a subject that's very near and dear to my heart as well. So I'm looking forward to the conversation. To kick us off, at the Diagnosing show back in July in Denver, you actually won a competition that they had. It was Dentistry's Got Talent. And I know that part of your presentation there is, you kind of walked through a little bit of your backstory, and you really have this fascinating journey that has taken you to where you are today. Can you share some pieces of that with the audience?
Yeah, so I escaped my country at the age of 6 for the American dream. During my escape, I was told, as I was on horseback through the mountains of Iran into Turkey, don't fall asleep. If you fall asleep, you're going to fall off the horse and die. And so from 6 years old on, falling asleep was kind of a big psychological issue for me. I was very conscious of, if I'm falling asleep at the right time, sleep was a big kind of hindrance growing up. And sadly, when I fast forward in 2009, I fell asleep at the wheel. I crashed my car into a tree going about 35 miles an hour. I walked away without a scratch. I had no idea that I was more tired throughout the day, but I had no idea it was because I wasn't breathing well at night in a condition called sleep apnea. So I got it tested. I did a whole sleep test back then. They gave me a mask. I couldn't wear it. It was too uncomfortable. Like most people don't like their CPAP machine, the continuous positive airway pressure. And then I found out there's a mouthpiece, and I'm a dentist. I've been a dentist now almost 23 years. So I was a dentist for about 7 years back then. And there was a mouthpiece that I saw in a journal, an article that helps with snoring and sleep. And so I was patient zero at my office. I made the mouthpiece for myself. And fast forward since then, obviously I sleep better. I've helped a few thousand patients on sleeping better with an oral appliance.
Talk about a high pressure situation for escaping your country and being told, don't fall asleep, you're going to fall off the horse. That's a pretty incredible story. And when you had that initial accident, what ultimately led you to understand that you had sleep apnea? Did you get tested for it? Did you have somebody in your life that was like, hey, I've heard of this? Like, how did that come to be?
Yeah, so being more tired. At the time when I was married, I was told that I was starting to snore, and once in a while I would gasp for air. So I would, my ex-wife would nudge me a little bit with her elbow to make me kind of go on my side, to sleep on my side. And I talked to a patient of mine actually, and he's like, so, how's everything going with you? And I said, I just had a car accident. And he's like, how are you sleeping? Because I have something called sleep apnea. I'd fallen asleep at the wheel. That propelled me to do a sleep study, a whole sleep study that he recommended me to, the company that he used. And that whole sleep study revealed that I have mild sleep apnea. And so again, not being able to wear the mask that the physician gave me, I dived in about this mouthpiece, desperate to help me because, I almost died. And I imagine if I crashed my car into somebody else, right? Or another car. Luckily it was just a tree. So that's kind of how my journey started, was self-assessment, knowing that I was tired throughout the day. I was getting a little foggy in the morning, more brain fog, memory loss throughout the morning, throughout the day. It took me a while to kind of get happy, a little bit more grumpy in the morning. Grumpy Dr. Rad was kind of like, oh, Dr. Rad's grumpy this morning. I'm like, I'm not grumpy. I'm just tired, and then by 10 o'clock, when the 1.5 cups of coffee kicked in, I was like, all right, let's go. Let's do this today, and do a song and dance for my patients and my staff. But, it's hard to push through. But once you figure out that your energy levels are being affected, your bed partner is being affected, and there's apps now that you can record yourself at night to see if you snore if you don't have a bed partner. And so I made my mouthpiece, and it changed my life, and that's how I made me go forward in helping other people.
No, that's a great story. I had a guest on the show a few months ago, Kerry Strain from Kerry Strain Dental Management, and he has a really personal story about sleep apnea and a family member, and it is a really serious thing. I don't think a lot of people probably understand the negative effects that it can have on life, and actually that it can be a life or death ailment that people have. You mentioned the CPAP machine. And so when I said earlier, this is a near and dear to my heart. So I have sleep apnea myself, and I use the CPAP machine, and it's a incredibly frustrating device for a variety of reasons, not the least of which, you get this like dark red on the top of your nose from using it consistently. And, I've been using it for years, and now the outcome is far better than what it was when I was just suffering and not actually using the machine. But talk a bit about what these other options are, what they look like, how they work, what the involvement is for a patient in order to be treated or fitted properly, how they function, and kind of what the overall success is in general for the treatment that is not the CPAP machine.
Yeah, so you really have three big treatments. You have CPAP, you have oral appliance, and you have a couple different kinds of surgeries. And so a lot of patients are CPAP non-compliant. They don't wear it enough for it to work for them, where it's too cumbersome, they don't wear it at all. And so really the second line of defense has been oral appliance. I consider it the first line of defense. If you're mild or moderate, you stop breathing under 30 times an hour. That's considered mild or moderate. Once you hit 30 or more times an hour on a home sleep test or a lab test, you really should be on CPAP because it's more predictable. The surgical components are kind of like a rotor-rooter of the back of your throat, right? The uvula, that punching bag gets removed, the tonsils get removed, the pharyngeal throat muscles get lifted. Unfortunately, that's only about 50% effective. The reason why people do that kind of surgery is they don't have enough teeth to make a mouthpiece. They can't tolerate the CPAP. And maybe they already have really swollen glands like tonsils or whatnot that need to be removed, but it's not the cure-all. And then there's another surgery called Inspire. Inspire is a implant that's placed under your muscle here under the chest. And when you sleep, you put kind of like a device on top of it. It's like a remote control. And every time the tongue relaxes, it sends an electrical signal to the tongue to contract and become more taut or strong, kind of, and not so relaxed, to push the tongue away from the palate. When the tongue is more rigid and taut, it's not falling back and hitting the back of the throat, causing this suction called sleep apnea. The vibration that you hear, that's snoring. When the tongue falls back enough and vibrates against the back of the throat, that's snoring. So besides, there's sleep hygiene. Try not to sleep on your back because gravity pulls your tongue back. Obviously, losing weight can help if there's a lot of fat restriction around the neck muscle. But looking at you here on the call, and if you look at me, we don't look like your typical overweight patient. And if we are overweight, the problem is to lose weight, you need to sleep well. So it's a catch-22 because when you sleep well, you produce a hormone called leptin. When you get into deep sleep and you dream and you recover, leptin production allows your metabolism to go up at rest. It allows you to not eat or crave really bad, sugary and fattening foods. Like if you remember, if you're pulling all-nighter, you go out with the boys or hang out, the next day, you're not craving salads. You're craving pizza, right? You're craving burgers and fries, your body feels depleted. So it's hard to lose weight when you're not getting restful sleep. So again, people want to lose weight. They got to have something like a CPAP or an oral appliance to help the breathing so that they can be successful in the diet plan and the exercise program.
Now, would it be a fair statement that not everyone that snores has sleep apnea, but anyone that has sleep apnea snores?
Yeah, so not everyone. I've had many patients that snore. We do a home sleep test. They don't have apnea enough to say you need a CPAP or an oral appliance. It's just a knowing that you snore, and you're going to annoy your bed partner and your friends and family when you go on vacation or camping or whatever. But I still make mouthpieces for them. Those patients should never be on a CPAP if you just snore. So it's good that we test them when you do snore, because then you can tell, okay, like no sleep apnea, oral appliance will cure your snoring, and we're good to go. Now, if a patient has sleep apnea, most of the time they snore, not all the time. There's something called central apnea. It's a neurological apnea. That's why a sleep test is so crucial to see what kind of apnea that you have. Central apnea patients are usually on CPAP machine, and they need oxygen to be blown down their throat. So again, to find out what kind of condition you have, such an easy home sleep test. I do a lot of teleconference with my patients who reach out to me through my social media, through email, through my website, and I can refer them for a home sleep test. And once we know what the results are, I can guide and direct them towards physicians or dentists in their city or community to be able to get treatment.
So when I first discovered that I had this, I went to my primary care physician. But talk to me about the opportunity that exists within the dental industry to provide a higher level of patient care and to be able to identify sleep apnea and treat sleep apnea within dental practices.
Yeah, so we see somewhere between 15 to 30 patients a day in a dental practice. A dentist or a hygienist that's trained to know what to look for can look in the mouth, look at some of the tail signs of struggle for air. I'll give you two of them. One of them is grinding of your teeth where your lower front teeth are wearing down. So if we see lower front teeth worn down because people are grinding their jaw forward to open up their airway in the middle of the night when they're sleeping and not breathing, that's a tail sign that there's possibly sleep apnea. Striations of the tongue. The side of the tongue can cause what we call scalloping or indentations of the tongue because the tongue is thrusting against the back of the teeth, causing these little striations, or we call it scalloped tongue. That's another indication. If you were in my office and I saw one of those two, I'd be like, Mike, how well do you sleep at night? Anyone tell you that you snore? Have you ever had a sleep study? And I would help guide you. And of course, if you told me, yeah, I sleep like crap, my wife doesn't like sleep in the same room with me, I'm tired throughout the day, I now have also the medical conditions. I can look at a medical history of any dental patient. If I see high blood pressure, acid reflux, a history of cancer, heart attack history, stroke, depression, frequent nighttime urination, and the list goes on and on. Diabetes type 2. These are all comorbidities or medical associations that sleep apnea can cause. So those are red flags. I see any of these red flags, I have the conversation in my hygiene appointment or a crown appointment or a root canal appointment. If I see these things, I do my dentistry, I stop for a second, I share my knowledge, I ask the patient if they need help with it. We have that conversation. If they do, I refer them for the home sleep study. Then we decide on the type of treatment depending on the study.
How many general dentists do you believe are currently looking out for this and helping their patients in this way? Is it a high percentage? Is it still relatively low? And maybe you can expand a little bit on it with what are the benefits to a practice separate and apart from the increased level of patient care that a dental office can receive if this becomes part of their offering and their treatment that they provide to their patients?
So there's roughly around 200,000 dentists in America. And it's estimated about 5% of dental practices are actually making sleep appliances, let's call it on a regular basis, at least a handful a month. Unfortunately, most dentists take the course. They don't know how to continue and implement a system. They worry about the medical billing. They worry about the sleep test. They don't know where to send it to. And that's what I teach. I teach on how to be able to incorporate in dental practice. And we incorporated successfully. Not only is the dentist adding six figures, on average about $210,000 the first year to their dental practice, which is a financial incentive. But forget about the money for a second. The quality of life that you add to your patient, that patient is going to be a patient for life. You've changed their life. Now, I love doing crowns and Invisalign and traditional braces and placing implants. Sure, I improve their oral health and get them out of discomfort most of the time, but nothing is more rewarding self-gratification than helping someone sleep better. In return, it reduces patients' clenching and grinding, their acid reflux, and so it protects their teeth as well. So not only am I helping them with their sleep, I'm also protecting their dentistry, their dental investment, the stuff that they've done with me within the dental field. So it's crucial for dentists to be able to look in the mouth, look in the medical history, screen the patient. If you don't want to deal with it, just let them know, I see a problem. I see the airway could be obstructed. There are some signs connected to sleep apnea. Please talk to a primary care physician, or here's a sleep MD in our area, Dr. So-and-so. Go have a consult with them if it's something you don't feel comfortable in doing. Because you're looking in the mouth, you see the signs of a struggle for sleep, just like some of the things we talked about earlier. You got to share that information and refer, just like you would refer any other procedure as a dentist if you don't do it within your own office.
So now you still practice chairside and you have these courses and you're a real advocate out there in the industry to help others out. How do you prioritize where to spend your time?
Wow. That's a beautiful question, because sometimes I feel like I have to see patients because that is my duty and my Hippocratic, my oath that I've taken to be able to not only provide the knowledge that I have, but also I know if I teach one dentist, they can maybe help dozens of patients, right? So my goal now is to be on podcasts, be on TV, be in journals and magazines and newspapers to share awareness about how you could self-assess a general person. You can self-assess how to be able to know if they have a possible condition and where to go to be able to get treated, whether it's through me, through a teleconference, or through their own dentist that hopefully myself or any of the other instructors have trained. So I believe 2 days a week, at least 2.5 days a week of clinical side dentistry keeps me in the loop of practice and to understand how the blood, sweat, and tears that the dentists go through in a practice, and the changes that occur in insurance and the economy and everything that kind of can affect a practice. So I'm kind of understand that part, and I understand how it's important to educate them. So I give as much time as I can, Thursday, Friday, Saturday, and Sunday at conferences to be able to teach and educate so they can go, and I can help a dozen doctors, they can help 1,000 patients.
So we work with a lot of DSOs. Our software kind of lends itself to multi-location groups and dental service organizations. What has been the appetite or desire from your perspective from DSOs to implement and incorporate a sleep apnea treatment practice into their organizations?
So any DSO that's listening, when you add sleep to your practice, you set aside, you put yourself in a different platform of a dental group. Now you're treating in a more holistic, total health aspect dentistry. That will bring up your general dentistry. By definition, when you internally market within your office. Let's say you have 1,000 active patients, 10 offices across a certain area or more, right? You have 10,000 active patients in your database of all your offices. You internally email market. We now treat sleep apnea and snoring. If you or a loved one are suffering from this, come in for a complimentary consult or bring it up at your next appointment. Boom, right then and there, you set yourself apart from any other DSO or any other dental practice down the street, that you're doing a little bit of a different kind of approach to total health and care for your patient. That's number one. Number two, if we can add 6 figures the first year to your practice as a DSO, and you've got 5, 10, 20, 30 practices, the EBITDA is not just 6 figures, it's 5 to 10x of the 6 figures. So if we're adding $200,000 per practice, that's really 1.2 to 1.5 million in your EBIT, in your evaluation that you're adding. So the numbers are there. The heart-centered care approach is there. And ultimately, setting yourself apart from all the other practices that are, let's say, don't have operations that they can put this in play. The resistance, Mike, is really we're doing so much already. Well, okay, then you incorporate implants, you have an Invisalign or orthodontics, or you have all these other cares. Why not sleep? By the way, the ROI on sleep is so much more. An appliance, a typical appliance is $400 or $500, and a cash fee is about $3,000 minimum. So you're talking a big, nice ROI for DSOs to be able to, and the education can be all done virtually. It doesn't take months and a clinical experience to know how to, like placing implants and cases there. It's such an easy part of dentistry to incorporate. It's just, you need to know who to refer for the home sleep study, which that's what I train and teach. If you want to do medical billing, which medical billing company to use, how to incorporate that with the patient, or just charge cash like you do for ortho or implants. Anyway, that dental insurances don't cover. And start speaking to patients, start educating them through internal marketing and through forms to give them when they come in as new patients to evaluate their sleep. And boom, now all of a sudden you have a sleep practice within a dental practice that's lucrative, that's saving lives. I mean, I don't know, did you know, Mike, if you don't wear your CPAP, if you don't wear a machine, if I don't wear my mouthpiece, on average, that's 12 to 15 years off our lives. I mean, name one procedure in dentistry that reduces your lifespan by 12 to 15 years, clinically studied. There isn't any. To add 12 to 15 years to your life by doing a procedure, 5 times high risk of cancer of any kind, a new University of Wisconsin study showed, and you're lowering the patient's risk of cancer. This is the flex for DSOs to market, to show and educate through newsletters, through email campaigns. Wow, now DSO X does this. It's a game changer for the practices.
That's a very compelling case that logically makes a ton of sense. And, I track it, of course, because I understand, what life with sleep apnea is like untreated and how detrimental that can be. And, when I hear you walk through all of these things, I go like, yes, that makes sense. And yes, like why would you not do this? But earlier in the conversation, you did make a comment related to, look, we'll have dentists that come through and they'll do the course, they'll take it, they'll understand, what needs to be done, but then maybe they still don't do it. And I think that headwind that you face in dental period, and any industry for that matter, when you do something different or you introduce a change, the change management can be overwhelming, even if at face value, it seems to be relatively straightforward with a tremendous amount of upside. What are some of the ways that you help people get over that hump? Once they start to understand, they see the value, they agree with it, yet they're still challenged in the actual implementation of adding sleep to their practice?
Great question. How did I start? I started because I became patient zero. Then I treated patients that were my staff members' spouses, for example. I treated friends of mine in my own friend circle. When you become a patient, you become someone that you become an advocate. So my recommendation is, if for anyone in a dental practice, let's say you're a dentist and you have a hygienist, two staff members in the back, two staff members in the front, somebody has either a partner, a family member, or themselves are not sleeping well. Go through the process, get a home sleep test, get an oral appliance, see the interaction, practice on yourself, on somebody else in the office, see how it helps them. Once you hear how well it works and how it makes such a big difference in their snoring and their energy and their mindset, their mental health. 46% of depressed patients are sleep apnea patients. So once you hear the mental health improve, I think most people get sold in wanting to do it within the practice. I mean, how many times when we start doing implants, why do we do it? Because someone's missing a tooth and you see a tooth missing, right? And you want to recommend replacement, and all you do is a bridge or a denture. Well, if you want to do an implant, you got to refer it out. So you start learning how to do it. When you look in the mouth and you see the tail signs of a person struggling for air, as we discussed earlier, you got to at least try. They can tell you, no, I'm okay. I don't want to spend $3,000. I'm fine sleeping in the other room. I don't really feel that tired. Trust me, 6 months later, 12 months later, they come back for a checkup. They're like, you know what, Doc? I'm starting to feel like my blood pressure is going up. My MD now brought it up to me. What were you talking about last year about that mouthpiece? Or I got that email from you last month, how it can affect high blood pressure. So again, it's the incorporation. Once you become a patient or someone within your group is a patient, you become an advocate. That's how I would say, if you want to really feel how it works, make an appliance for yourself if you snore or have these kinds of symptoms, and see how it works for you.
What's the process for making the appliances?
Yeah, so it's so easy. My staff does it. It's an upper and lower impression or scan. And then we have these little jigs that put your jaw in certain positions. We can do end to end. We could do 1 millimeter where the lower jaw is slightly forward by 1 millimeter, jig number 1, jig number 2, jig number 3. So we can place the patient at the starting position of edge to edge, 1 millimeter forward, by putting that jig in and taking a bite registration with a scanner or with impression material, like a bite impression material. That gets set to a lab. The lab makes the appliance. A couple of weeks later, you get it. You give it to the patient. You put it in the mouth. You make sure it's not too tight, not too loose. The patient goes home and sleeps with it for 1 week. If they have a bed partner, we ask them how the snoring is. How much percentage improvement have you gotten? Do you dream more throughout the night? Do you feel more rested throughout the day? Do you stop getting up to go to the restroom as often? Some people say, oh, I get up 3 times. Now it's 1 time with the mouthpiece. If you see no benefit yet at the starting position, and I usually say start them edge to edge for mild patients, the appliance is adjustable to incrementally bring it forward by millimeter increments. So I move the jaw or the appliance more forward on the lower by millimeter increments every week until we have them dialed in that they feel those positive, let's call it, symptoms that an appliance can give you.
And what is the general feedback from a patient upon wearing the appliance? Is it challenging in the same way that a CPAP machine is? Is it uncomfortable for some folks? Is it easier to get adjusted to? Kind of how do you advise a patient when you're first delivering and fitting them for this?
Yeah, I always tell them it's going to take at least a couple nights to get used to. Most patients, male patients, have a little bit of an easier time. They have more elasticity in their jaw due to testosterone production or whatnot. And also their mouths are typically a little bigger than female patients. So I usually say it takes a couple nights to about a week to get used to having it in. My main trick or recommendation is try to put it in right before lights out. Don't put it in right after you floss and brush your teeth, and then you go sit in bed and try to talk to your bed partner, watch a movie, listen to a podcast, read a book, and sit there and struggle with it for 30 minutes to an hour. 15 years later, I bring mine to bed with me, and I sometimes leave it on my chest as I'm reading, or put it on my nightstand. And right before I turn off the light, put my phone into the charger, I grab it and put it in, and I go lights out. The closer to sleep, the more comfortable and the easier you get adjusted to it. The CPAP patients who hate their CPAP or want to transition into a mouthpiece, almost always they're like, oh man, this is so much easier to wear than a CPAP machine, especially when I travel or to clean it. I just have to spray it. I've made a spray called Rad Fresh. So you spray the mouth guard a couple times, it kills off all the fungus and bacteria. As you know, with the CPAP, the cleaning process is a little bit more time consuming and required so that you don't get respiratory infections. So yeah, just like everything else, we has to have a little bit of a getting used to adjustment. But again, you're going to snore less, you're going to live longer, you're going to have less likelihood of getting cancer and diabetes and all these other medical conditions. It's worth trying. It's worth the money. It's worth the effort. It's worth the time. We want to have you here longer on this planet and living a quality of life. A third of our life is spent sleeping. On average, we want to sleep 6, 7, 8 hours, right? So it behooves us to be able to do it the right way and to at least attempt it. And you got really 3 options here. You got the CPAP, a lot more cumbersome, got the oral appliance, and then you've got surgery, which is a lot more brutal.
The life expectancy argument by itself is just incredibly compelling. If you have that type of control to provide yourself that benefit of at least removing that from the equation of something that's going to be detrimental to the amount of time that you get to spend with friends and family, like that's something that I think by itself should lend itself towards those that are feeling tired, that think that they might have sleep apnea, to making sure that they go, that they get the test, that they get evaluated, because it really is life-changing. This has been an amazing amount of information. I really do appreciate it. We'll wrap up here in just a second. Before we do, one last question of you. You're out and about, you're talking to clinicians all the time, spend a lot of time with people in this industry. When you look at dental as a space and you kind of are looking forward at things that are happening, things that are changing, what are some things that like get you excited, where you're like, you know what, there's a bright future for the dental industry. There's a bright future for people that want to become dentists. Like, what are the things that are out there right now that are cause for inspiration?
So the biggest thing for me is a shift towards holistic dentistry and getting away from certain procedures and medications that can hinder the body and hurt the body while you're trying to fix something else. Fixing sleep is exciting. It's been around for 14, 15 years in dentistry, and the more it grows, still not that many dentists are doing it. That's my biggest push, is to train as many DSOs and dental offices to put this into their repertoire of services. The low-level laser therapy, I speak on behalf of Zirconia Laser, has been revolutionary in my practice. It's a point-and-shoot handheld laser, no numbing, no side effects, FDA clearance, and approved for post-operative pain to reduce pain after you pull a tooth, TMJ, tightness and pain, neck and shoulder pain for patients and dental practitioners and whatnot. And now we're using it also to for the soft palate, to make the palate a little bit more taut, so you have a little bit more room between the tongue and the soft palate for sleep. So low-level laser therapy has been kind of my exciting new chapter in dentistry. It's already been in the medical world, and I'm bringing it to the dental world to show its efficacy and how you can reduce pain by 45% clinically shown after you do a procedure without having to do any medication relatively. I mean, before we used to give them opioids and ibuprofen and Advil and Tylenol, and now we can help healing, promote healing, reduce their microbiome, and reduce the pain after we do something that causes pain, which is a lot of different kinds of procedures in dentistry. Wow. I mean, every person, I believe every office, just like you have an x-ray machine or a CT scan or an ultrasonic scaler, you should have a laser that doesn't cut anything. It just helps promote healing. And medical insurance, as of January 1st, 2024, is covering post-operative pain usage of that low-level laser therapy. And anyone wants to get more information about it, I'd love to share that personally and privately with practitioners out there.
That's fantastic. Well, hey, where can people find you? Where can they find any of your products, your seminars, courses? Kind of share all the information, socials, websites, whatever you got.
Yeah, so my website for my courses that I teach, and you can send messages through there, is radseminar.com. Radseminar.com is the best way to reach me. My first name, last name, Dar Radfar @gmail.com. You can also contact me through that. And if you Google my name, you have my Instagram and my Facebook. I answer all those myself. I'm a big push in education and collaboration and networking and teaching. Anyone has any questions, they want to get a home sleep test, or they want to know how to incorporate this, we can always get on a Zoom call, a Calendly call. Once you message me through radseminar.com, and we can talk and see how I can help you.
Awesome. Hey, thank you so much for joining, Dr. Rad. Really appreciate it.
Thanks, Mike, and go 49ers. Hopefully they'll make it this year.
Hopefully it's a rough start, but go Niners. Appreciate it. The Dental Economist Show is brought to you by Planet DDS, home of Dental OS. To find out more about how cloud-based dental software by Planet DDS helps unleash dentists and their staff to focus on patient care, visit www.planetdds.com. Stay tuned for upcoming episodes by following wherever you listen to podcasts. And thank you for listening.